Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your college of entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Paramyxoviruses. So Paramyxoviruses are RNA viruses which include measles, mumps, and respiratory syncytial virus or RSV, which you will have heard of during your medical training. On the right of this screen, we have the basic structure of the measles virus, which can give you some indication of just what the components of these viruses are. So we're predominantly going to be talking about the three which I just mentioned, which are measles, mumps, and RSV, and we'll take each of these in turn. So if we look at measles in particular, the incidence of measles and mumps is less common in the UK due to effective immunisations. However, the incidence of measles has been rising due to poor vaccination uptake, due to misinformation about vaccines, which came about within the last couple of decades. The Health Security Agency has been recording the numbers of measles cases over the last several decades, really. And it's important to note that the measles vaccine was first introduced in the UK in 1968. And so in 2021, the number of cases was 360. In 2022, it rose to 735, so basically almost a doubling. The 2023 saw a further approximate doubling of cases to 1,603, and the 2024 numbers so far are 2,465, and that is correct from September 2024. At the time of watching this video, of course, numbers may have changed. In 2019, in England and Wales, there were 4,411 laboratory-confirmed cases of mumps. In the following 2 years, case numbers were much lower, likely due to COVID restrictions and therefore a less avid spread of the disease. And finally, RSV is a common respiratory pathogen in children and elderly people, and there is actually a vaccine now available for this in the UK for 75 to 80-year-olds. There is a potential for this to cause severe outbreaks, particularly in paediatric units. So for those of you who've done paediatric jobs, especially over the winter period, you will be probably very familiar with this virus and how it presents and how to manage it. So let's now take each of these viruses in turn, and I'm going to start with measles. And this really comprises two phases which you need to be aware of. The first is the pre-eruptive phase, and the second is the eruptive phase. In the pre-eruptive phase, people with this condition will get fever, coryzal symptoms, conjunctivitis, and Koplik spots, of which there is a picture on the right-hand side. These are grey on a red base, and usually occur opposite to the second molar, so that's really how you can best identify them. In the second eruptive phase, a maculopapular rash is present, particularly over the face, and later this becomes confluent in nature. Measles can lead to systemic spread, involving many organs, especially the lungs. The infection may well be complicated acutely by bacterial infection. Subacute sclerosing panencephalitis may result as a late complication, so this should be monitored for. We'll now move on to mumps. So this is characterised primarily by parotid swelling and rarely can lead to meningitis, encephalitis, orchitis, and pancreatitis. So they're really the main signs and symptoms to look out for in any MRCP vignette. For example, in part 2. In rare cases, you may be asked to take maybe a history or a communication station from a parent or carer regarding the presentation of mumps as well. And on the right-hand side here, we can see that classic parotid swelling that comes with a mumps infection. We'll finally talk about RSV. So this is characterised by an upper and lower respiratory tract infection. Most infections are mild, but some can lead to severe and sometimes fatal disease, especially in neonates, very young children, and immunocompromised adults. It's important to note that all three of these infections are based on a clinical diagnosis primarily, but this can be unreliable due to overlapping symptoms with other viral infections, the classic ones of which would be non-specific rashes and a cough. It's possible to isolate mumps from saliva, and measles and mumps are often confirmed with serology. RSV may be identified from nasopharyngeal aspirate or bronchial lavage using immunofluorescence. Vitamin A is considered beneficial for malnourished children with measles, and RSV is sensitive to ribavirin and can be administered via small particle nebulizer for severe disease in neonates or the immunocompromised. Obviously, vaccination is a key part of management, particularly for measles and mumps. The MMR, or measles, mumps and rubella vaccine, protects against measles, mumps and rubella. We haven't spoken about rubella in this presentation, but we will have a separate video on this. The first dose is given at 12 to 13 months in UK children, and a booster dose is given subsequently at 3 years and 4 months. Before introduction of the vaccine, cases were extremely high, and once the vaccine was licensed in the UK, there was a rapid fall in numbers. However, unfortunately, in recent years, there has been a fall in number of vaccination uptake, leading to an increase particularly in measles cases due to sharing of misinformation. For context, 2 doses of the MMR vaccine are 96% effective against measles and 86% effective against mumps, so you can really get a feel for why a lack of vaccination uptake would lead to much higher levels of infection and spread of infection. So we're now going to do some questions. First one is as follows. A 5-year-old boy presents to the emergency department with fever, cough, coryza, and conjunctivitis. A red maculopapular rash appears from behind his ears, spreading down to his trunk and limbs over the next few days. Spots within the mouth are noted on examination, which are grey in colour on a red base. He is not fully vaccinated. Which of the following is the most likely causative agent of this child's symptoms? So our options are influenza A virus, respiratory syncytial virus, or RSV, measles virus, mumps virus, or parainfluenza virus. So from earlier in our presentation, you should be aware that in this case, measles is the correct answer. And hopefully you've remembered that those spots that are described are Koplik spots, which present within the mouth. Which of the following viruses is not a member of the Paramyxoviruses family? So our options are measles virus, mumps virus, RSV, influenza A, or parainfluenza virus. So you really should recognise the first 3 because we've gone into depth about those. So measles, mumps, and RSV are all part of this family. Parainfluenza virus is also part of the Paramyxoviruses family. So the correct answer here is D, influenza A virus. And if you do want to brush up your knowledge on influenza A, you can rewatch our video on this particular virus, which is available earlier in the Infectious Diseases series, or if you just click the link at the top of your page right now. A 65-year-old man with a history of COPD is admitted to the hospital with worsening dyspnea, productive cough, and fever. His chest X-ray shows bilateral infiltrates. A nasopharyngeal swab is positive for RSV. What is the most likely reason for the increased severity of RSV in this patient? So our options are incomplete vaccination, pre-existing lung disease, viral mutation, immunosenescence, or bacterial superinfection. Now, while all of these in theory may be possible, we have to think about the most likely cause from the information we've been given. And in this case, the correct answer is B, pre-existing lung disease, because we've been given that information as a certainty. And also, having had COPD for a number of years, most likely, and given the comorbidity that comes with that, that is probably the most likely reason that this patient will suffer a more severe bout of RSV. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.